There. Hello and welcome to Eye Openers. Thank you guys so much for being here with me today because if you weren't here, Charles, and if the audience wasn't here, I would literally be having this conversation with myself, and that would be kind of funny. Sometimes I do. Sometimes I have my own conversation about, how should I be improving my business? How should I be leading my life? How does this get 10% better? But I promise you, these conversations are so much more solid when I have other people joining. So thank you, Charles, so much for being here today.
Well, I'm so happy to be here, Brittany, and excited to have this conversation with you today.
Oh, me too. Me too. But first, coffee. We always chat about what you're drinking on this show because we believe that caffeine leads to eye-opening moments, moments around how you can better be leading in your life, in your business, your team, your culture. And for me, coffee is a way to definitely spur that to happening. So tell me, is this an iced coffee or you just really like your glass mugs?
Well, I can say I'm not much of a coffee snob. I am whatever is around, whatever's within hand's reach is really what gets me going in the morning. So as I wake up from the bed, roll over, brush my teeth, get up during the day, just press the button on the DeLongo and let the coffee go, and whatever it is, it is.
I love that. You're just a pretty straightforward operations person. Just there it is. Let's do it. For me, I've recently gotten into this pour over trend. I'm not sure if you're familiar. Like you can order the pour over at your cafe, but it takes so long. And for me, I was trying to kind of habit stack, right? So building on, we're going to talk a lot about behavior modification and stuff like that today. So I wanted an exercise that felt a bit more like intentional and um, almost like meditative in the morning. And so when I make coffee, because it's like a 7-minute experience to like go to make it a pour over, I have my meditation playing for the morning about like thinking about my whole day. What am I shaping? What do I want to create? What's most important today? What am I letting go of? And I have this like thought exercise while I'm like pouring the hot water from the kettle like over the grounds. And it's a new habit for me, but I'm really enjoying the intentionality of it.
Yeah, I can see that. Yeah, I have my co-founder Brandon. He is methodical about the pour over and has a accoutrement of different equipment and array. There's a beaker, and one goes into another that floats into another contraption that filters. So it's quite an experience to watch. I don't know if I would have the behavior modification to do that on a regular basis because I tend to be a little impatient.
No problem. I totally understand it's not for everybody, but I'm appreciative of that process. So I've got to see his I'll see his equipment sometime.
Hopefully, he won't sway you down the dark side.
Yeah, I'm not sure I could get into that whole big process, but baby steps, right?
Exactly.
So let's thank you for entertaining my caffeine and eye-opening moments idea there. But let's tell the audience why you're really here. So give us your bulleted bio is usually what I ask for about why you're here on the show with us today, and yeah, what we're going to chat about.
Sure. So my background is in data science. I specialize in AI assisted robotic devices for the home, and we study patient behaviors in order to get better health outcomes for the population. So that's it in a nutshell.
Perfect. And tell me the story that led to you founding this company.
Yeah, so the story is one of happenstance. It was not by design. There was no eye-opening moments until the eye-opening moment for me was really the light blinding me in the eyes on the operating table. So let me rewind a little bit. And when I was in my early 20s, I went to the physician to get diagnosed because I was having a pain in my abdomen. And what they thought it was a kidney stone because I have a family history of kidney stones. So thank you, Dad. And I went back again a week later, and they found out that it was not a kidney stone. At that time, it was a different physician, and they said, "Great news, Charles. We know what you have. You're going to the operating room." So that was my eye-opening moment when the light shined upon me on the operating table. But I had a ruptured appendix, and it was mission critical. And thankfully, and I'm very grateful for the physicians that worked on me because they saved my life.
Mm-hmm. Yeah. Yeah. Um, I don't know if I shared, my niece had an appendectomy last week. And it's just one of those things, like it happens in that moment. It's a total emergency, like when it's happening. And yeah, it can just come out of nowhere. And I know a lot of really healthy people. My neighbor, who I'm really close with, he had one a few years ago. And it was like, throw the kids over the fence kind of moment. We got to go to the hospital. And it is a really, it can be a kind of like life shifting experience for a lot of people, because relatively healthy people, this happens for them and it changes their perspective of their health. And so what did it shift for you that day?
Well, it changed my entire perspective of how things could be in the future because, when I was in my early 20s, I was very naive in regards to communicating, interacting with providers. And because I wasn't able to communicate exactly what was going on with myself and my body, it's hard for them to understand and treat you accordingly. So this communication that goes back and forth between patient and doctor is mission critical, but oftentimes you have a subject matter expert being a physician or a nurse, and then you have the other side, which was me, not very sophisticated at that time and couldn't really articulate exactly what was going on. So it really opened my eyes to some of the issues and challenges that many physicians and patients experience on a regular basis.
Right, right. So when you were starting to understand some of these challenges, like help me bridge the gap from that experience in the OR to now working with behavior change and how you're trying to guide that to impact lots of people's lives.
Yeah, so it's easy to connect the dots from the past to the future. So I'll connect those for you pretty quickly. But that changed my trajectory in life. So I was following my brother's footsteps. So first it was my father, now it's my brother. And my brother's footsteps was in investment banking. So I was a finance major. I worked at a bank. And after that incident, then I decided to change the trajectory and work for a small healthcare company called Johnson and Johnson. That company gave me the foundation and exposure to healthcare that I always longed for. And it opened up my eyes because I was not a science major, but I was studying healthcare. And it was a fantastic experience. It gave me exposure to talk to the people that treat face to face the majority of the population, which are your physicians and your nurses. So by having those communications and seeing how they practice medicine, which is called empiric treatment, which is based upon their medical school education and their clinical experience, they assess each patient and then treat them accordingly. And that's the best that they have right now. So I was trying to figure to myself, well, what if there's a better way to care for people so we can figure out a blueprint for medicine? So that's why I decided to start this company. Is there's got to be a better way to treat people. If providers knew if patients were taking the medications, then we could know definitively which medications work best for whom.
Oh, I love that. I love that. That is just such a big problem. I know my husband personally, he's a physician, and in the ER, they get like a medication list, but they have no idea, how people, they're self-reporting, right? And what we know is all the bias that's inherent in self-report, and that it really, really changes. If you had actual information. So, gosh, I mean, from Johnson and Johnson, which I imagine is, it's a big corporate experience and it's a pretty like safe job. How did you get the courage, and what was like kind of running through your mind to launch this company? Because so there's a lot of entrepreneurs in the audience right now that are going to be listening to this, and these stories, these moments of like what was going on in your head and what how you initially took that leap.
Mm-hmm. Well, I had a number of experiences. I worked with a number of Fortune 500 companies. I was also a mentor at StartX Med, which is a Stanford-based accelerator. So it gave me exposure to a number of startups within Silicon Valley. As my career trajectory, went through a couple different companies, I started to notice that the variabilities of practice are so wide from city to city, state to state. Because I was able to see different health systems, to see different providers, to speak with patients across the country. And what you see is many different variables multiplied exponentially across the healthcare system. So it's very complicated to replicate best practices in one area in another when you have different labor pools and technology and processes. So it started to spin in the back of my head is there a better way to do things now so we can create more of a standardized environment? And the biggest opportunity from my perspective is really where you and I both stand right now, which is in our home. We have no idea what's going on with patients in their home, and that could be fixed right now.
Right. That's awesome. I love the way that you're thinking about that, because so often I feel like it's another medicine, something else I need to take or do or whatever, instead of working with, hey, just let's better understand the patient's daily experience and work within that. Because what I know about behavior change, which is what I do for a living, that if we can shrink the change, if we can ask them to make the smallest minute change, then it stands to be so much more effective, and people will be successful at that if we can just really pinpoint and identify and ask people to make the smallest change.
Mm-hmm. And you're speaking about daily habits, and we know that many folks, millions and millions of folks, are challenged with those regular habits and changing them over a long period of time. So if most folks in the country, around the world, are struggling with weight issues because of mobility and exercise, and also dietary and nutrition choices, then what we do to stabilize their conditions is we give them a prescribed regimen or a cocktail of different medications to stabilize their disease state, whether it's diabetes, cardiovascular disease, or something else that may or may not be controllable. But how can you expect somebody to take their medications as prescribed if they're struggling with their diet and their exercise? That seems like a lot to ask somebody when they already have existing behaviors that may not be in line with what's best for their health.
Mm-hmm. And so does HIDO show the treating practitioners, physicians, what's happening? Like, would they would understand how they're taking that medication, or would they be able to see other types of habits and let's say like eating or exercise?
Yeah, so HIDO is an AI-assisted robotic device that lives in the home, and it eases the burden on patients to follow the prescription of medications by their doctor or their nurse, but do it in a fashion where it becomes a habit. So you walk up to the unit, it uses Face ID, it unlocks, it dispenses the medications, then a patient walks up with a transparent cup and takes their medications. And what it does is it monitors the different behaviors. So let's say, for instance, Brittany, I send you a message on your mobile app reminding you to take your morning medications to make sure that your glucose levels for diabetes need to be decreased. So you take your medications, but for the first month, maybe you're doing it within 15 minutes. But now we're at month 3 and you're taking it every other day. You're coming in maybe 90 minutes late. There's an irregular pattern. Now your doctor or nurse can communicate with you is there something wrong at home? Is there something that's changed in your life that's prompting this behavior? Because right now, those conversations aren't happening because patients are self-reporting what's happening. And whatever they say is the basis of how a doctor or nurse can treat them. But if patients like you and me aren't entirely honest with what's going on, that there lies the underlying issue.
Right. So important. Yeah, that would just totally change the care people receive. Right. So I like the mutually beneficial incentive there to change it. So I imagine you had to do a bit of research or kind of come to a stronger understanding of what guides these human behaviors, how to modify, how to habit stack. Like, where did you have to really dive in, and what was something that you found interesting that you didn't know before?
Yeah. So oftentimes I guess the easiest lift from a technology perspective has the most monumental impact in patients' lives. So as awesome as an engineering feat that this is, and how we like to really go into the nitty-gritty with the design and architecture, it really comes down to something very, very simple and easy that's prompted that biggest behavioral change. So I'm going to use you and your husband in this instance. Let's just use you as an example. You're supposed to take your medications. You have deviated from your diabetes medication, and you are a frequent abuser or non-adherent, which means that you missed your medication for 4 or 5 days straight.
Yeah.
The fastest way to elicit change is text message your husband that you missed your medication, so then he can speak to you about it.
I love that. I love that. So calling on the patient's support network, right? So this is something you guys have already built in to the process. Wow.
Yeah. And what's interesting about this is this, of course, this wasn't our idea because it would be too easy. This was from a patient telling us that they wanted their caregiver or loved one to know so they could kick them in the butt. So a lot of the development and design of HIDO is not because we're super smart. It's really just listening to patients and responding to their behaviors and their needs, and then designing accordingly to how they want things to be changed in their life.
I love it. Well, what does everybody ask for when we think about like diet and exercise? It's accountability, right? So all of these apps and stuff that exist around that, right? It's to try to create that accountability system to make it easier to adhere. But man, there's nothing like a good guilt or shaming of sending it to to your partner to be like, "Hello, you missed your medication."
Well, I think it's more of because people know you care. So we don't see it as guilt or shaming. It's more.
Oh, I'm kind of joking, but you know.
Yeah. But you have it's like when you go to the gym, right? And you have your gym buddy or your coach or your strength lifting partner. I feel like if you have a team of people behind you pushing you forward, just like a group of entrepreneurs that need a little bit of support and guidance behind them. If you push with the right behaviors and the right motives, and everybody has the best interest of that person, it's amazing the results that you can get.
That's great. What a positive spin on it. That the truth is the person that someone would identify would hopefully be someone who really cares and who wants you to win and be successful, right? And so that conversation could be really supportive and helping you understand better how to drive the positive outcome that you initially signed up for. But you're right, we see this mechanism, this kind of accountability buddy in all this other kind of healthy habits that we're trying to bring into our life. And so it would make sense that why wouldn't we have this in healthcare?
Mm-hmm. Yeah. And it's also, I think it makes things easier for both physicians and nurses to treat patients, and also for patients to not have to recall, what did I do 30 days ago or 60 days ago or 90 days ago? A lot of that information is just lost in translation. So what if we knew if patients missed or took their medications at home? And what if we could correlate that with outcomes, which is ultimately what everyone's trying to uncover, is the blueprint for health. If we know the different cocktails and medications for people's different age, disease state, location, and other demographic information, and can mirror that with the different types of medications and the types of outcomes, we can alter the future of care for both providers and patients like you and I.
Mm-hmm. I love it. I love that vision. So what's in front of you right now? So if we think about, your co-founder CEO hat, what are you looking at right now that's going to impact the trajectory of the company? What's the problem, the challenge that you're trying to solve for?
Yeah, so right now we're in growth stage. So we're in growth mode. We're signing contracts, and we're very excited. Hasn't been announced yet, but in the very near future, we're looking to partner with a veteran home health company. So we like to service our vets out there, and we've done so in the past. So if anybody wants to take a look at some videos, you can go to HIDO Health and take a look at some of those. In addition to that, also some health plans in California that are very close to looking at expanding the HIDO offering for their patient populations.
Awesome. And I want to make it easy for people to connect with you, because I think that this is, when you and I were talking, I was just so impressed with what a positive impact that this is going to have. What's the best way, if people had questions, if they want to either be part of a preliminary study, or how could they connect with you?
Yeah, so the best way is to like and comment any of the videos on YouTube, because we do look up those on a regular basis.
Oh,
and
awesome.
You can just go to the search engine and type in HIDO Health, and you'll find us on YouTube. There's plenty of videos. In addition to that, if you go to our website, hidohealth.com, HIDO Health, please just go to the Contact Us button, and we will promptly respond to you.
And I know we're doing this live right now, but people will get that in the show notes and make sure that people have easy access to the links and ways to learn more about what you guys are up to. So what do you think, if we both have a penchant for behavior modification and change, where do you see this expanding into? I'm sure you've had daydreams about how else this technology could positively impact us humans. What do you think?
Yeah, I mean, there's a variety of different ways it can touch people. I mean, so far we've serviced folks with mental health conditions that want the help, and it really comes down to people wanting the help. But cardiovascular disease, cancer, heart failure, diabetes, hypertension, HIV, dementia. So if you really want to think about the future, just think how mind blowing this would be. What if people with dementia can care for themselves unassisted without caregivers? That's the research that we're doing right now with the National Institute of Health with Rush University. And that's possible. So just think of the type of impact that we can make worldwide with an aging population, multiple countries with an aging population, if they can care for themselves unassisted.
Right. And I know because there's so many business owners that listen to this podcast, and that's the premise of what we talk about here. I think about the business case for we know from data that healthier humans leads to a better workforce, like a more empowered and healthy and productive workforce. So I just think that the business case is there too to support rolling out your devices and seeing expanding on the technology. So I'm super excited to hear how this evolves and your guys' future success.
Yeah, we're very excited. We appreciate you letting us in on a little bit of this live content.
Yeah, it's very exciting. I think everybody needs to learn about how we can better support the people in our workplace outside of just their titles and their roles that they play from 9 to 5. So thanks again for being here, Charles. It's been really fun to learn more about you, what you're up to, and hear that backstory, which I feel like every successful startup has a really cool founding story. So thanks for being willing to share.
Yeah, thank you for having me. I appreciate it and look forward to staying in touch in the coming months.
Yeah. And thank you guys for being here, for listening to the content. If you liked it, please give it a thumbs up or hit subscribe wherever you're seeing this, everywhere from LinkedIn. Make sure you can follow us on our podcast page all the way to Spotify. You can find us there. Until our next eye-opening moment. Cheers, Charles. Thanks again for being here. And thanks to everybody for joining us. See you soon.
Yeah, take care.